Enter the room.
Good day. My name is Dr. Hello.
Hi.
Do I have a simulator?
Yes.
Okay.
So I'll start the doctor 1 second.
Okay.
Begin. Enter the room.
All right. Good afternoon. My name is Dr. Ngati. May I confirm your Dr. Natasha, can I confirm your name and age, please?
I'm Lynn. I'm 25.
All right. And how would you prefer I address you today?
Lynn is fine.
Okay. So Lynn, I see that you've come in with the history of having recurrent nosebleeds. Is that correct?
Yes, doctor, and I'm getting a little worried about this. I've been having these bleeds a little too often this month.
And how often is that over the last month?
Well, I've actually noticed that it usually happens in winters, and it's been like about like every 2 to 3 days.
I'm sorry about that. That's very quite frequent. And do you bleed from both nostrils or it's just one?
It's just I've only noticed it from my right nostril.
Okay. And how long does the bleeding last? And would you be able to quantify how much blood you lose at each time?
Oh, well, it's not a lot of blood. I mean, and it's kind of like 5 to 10 minutes. But yeah, I'm trying to understand why this is happening.
Of course. I'll do my best to find out what the cause might be. So what do you do to stop the bleeding at each time, or it just stops on its own?
Well, in like 5 to 10 minutes, it kind of does stop on its own, but then I kind of pinch it and I, lean my head backwards.
All right, all right. So do you bleed from anywhere else in your body, or it's just from the nose?
Um, Bleed from anywhere else? No, it's just from the nose.
All right. And has it happened? So you said it's usually during winter. Is it getting worse or better?
I mean, I think it's usually I kind of feel it more prominently during winters, especially when I'm moving from a warm place to a cold. Every time I'm stepping out, kind of have the sensation, you know.
Okay, okay. And do you have a cold or a cough whenever this happens?
No, not really.
All right. Do you have any nasal congestion?
No, not exactly.
No difficulties breathing?
No difficult.
All right. And is there any discharge from your nose besides the blood?
Not that I've noticed. It's just this few streaks of blood. But yeah, I get a
Oh,
little stuffy when that happens.
okay. And is there anything that you've noticed that makes it worse or better?
Well, when I moved from, like I mentioned, from a warm place to a cold, like especially stepping outside.
Okay, okay. Um, that's all right. And have you noticed any fever when these nosebleeds happen?
No, not really.
Okay. Have you had any loss of weight recently?
No, not that I've noticed.
Okay. Have you had any loss of appetite or noticed any lumps or bumps on your body?
No, doctor.
Okay. No sweating at night either.
No.
All right. And just lastly, we noticed, have you had any injury to your nose before this bleeding started?
No, not really.
Okay, that's fine. Just want to move on to find out some other things. Uh, are there any like long-term illnesses that you're currently being treated for?
No, doctor.
All right. And you're also not on any medication, including blood thinners?
No, doctor.
All right. And just to find out, are you on any recreational drugs? For example, you know, cocaine involves sniffing through the nose. Is that something you do as well?
No, not at all, doctor. Of course not.
All right. Seems a bit invasive, but just trying to find out what the cause may be.
No,
And sorry?
I don't do cocaine.
Okay. No, that's fine. And in your family, is there anyone else who's had any similar issues?
No, not really.
Okay. Are you allergic to any medications?
No, doctor.
Okay. Um, and sorry, just to ask again, do you pick your nose?
No, I try to stay away from that area.
Okay, no, that's fine. And do you drink or smoke, Lynn?
I drink occasionally, yeah, and I do smoke from time to time.
All right. And would you be able to quantify for me how much smoking or how much drinking that might be?
Well, occasionally with friends, probably on the weekends.
Okay.
2 minutes remaining.
All right. So I just want to ask, is there anything that you think might be causing this nosebleed?
I have no idea. I was hoping you could give me some clue.
Of course. And is there anything in particular that you want me to address today? And what would you want for us to do at the end of this consultation?
I don't know. I've read somewhere that it could be because of some bleeding disorder. I just want to find out if it is.
Of course. All right. So I just want to move on to do an examination where I'll check your vital signs, do a general examination, as well as do one more specific to your nose, so I can inspect it and see what might be going on there as well. All right. Okay. So, Lynn, putting together the information that you told me, as well as the findings on examination, I think your nosebleeds are caused by the fact that the blood vessels in the nose, they're quite close to the skin, and when it's winter, you tend to blow your nose a lot, which would then cause the nosebleed. Does that make sense to you?
I don't usually blow my nose as much.
Sorry?
I don't usually blow my nose.
Okay. Well, it's just a suspicion for now, but we'll just do some investigations to see what the cause might be. So some of these investigations, they'll include checking the blood immune system, how it is. We'll also do something called a clotting profile and something called an INR. This will rule out those bleeding disorders that you fear that you might have. Is that okay?
Move on to the next statement.
All right, Dr. Natasha. Good job. So, why did you think that it was due to blowing the nose? That was not a positive history that she gave. You asked about sneezing and a whole lot of things, but she said negative history on that, right? So, how did you extrapolate the fact that it was due to the blowing of nose?
Since you said it's mostly during winter, my suspicion was maybe she'll have a cold or a runny nose, and then that's how the bleeding starts.
Uh, yeah, that's definitely a risk factor to consider. But so this is a case of epistaxis. So you were absolutely right. This is usually because the blood vessels in the nose, it's called the anterior plexus or the Kesselback plexus. I really like the way it's off your tongue. So this is very close to the skin, and it's in the anterior septum. And usually, it's the dry, cold air that kind of makes these vessels friable. So it's spontaneous bleeding. All right. So
Mm-hmm.
it need not be that they actually are forcing, they are kind of having any positive pressure that is causing them to bleed, like sneezing or cough or fever. It's a spontaneous bleed. But these other things can definitely aggravate that for sure. Main reason is because these vessels get dried up and they're very friable, so they're easy to bleed, right? So
Okay.
it's very common among youngsters, especially in that age group of 25, right? Adolescent and young adults, right? So if
Mm-hmm.
you get this patient is actually 25. So what are the things that you need to be worried about in this patient?
One thing that I noted that I didn't ask were the symptoms of anemia, considering how often she's having the nosebleeds.
Absolutely. That's a good one. That's a good one. Yes, absolutely. Like dizziness, fatigue. Yes, absolutely. And what is the differential that you would be worried of? And okay, so there is, if at all you hear an anterior plexus, so there will definitely be an opposite of that. So there is also posterior plexus.
Mm-hmm.
That it's called the Woodruff plexus. Have you heard of this plexus? Blood vessel plexus?
Yes, from anatomy.
Yes, absolutely. So what exactly happens is this plexus also bleeds, and it's a more dangerous bleed in this case. All right. And
Okay.
usually this happens in adults. I mean, more elderly people with more, health risks like hypertension, atherosclerosis. So this is mostly a venous plexus, and this bleeds. And when this bleeds, it goes to the back of the neck. So back of the throat. So there is a risk of aspiration. So you just want to quickly rule that out, when you bleed, where does the blood go? And it's a little more quantity because of the underlying health conditions. This one also, now when you're looking into young people and streaks of blood, and that too anterior bleeding, where it's actually, they are actually bleeding from the nose, and you see that, it's not going to the back of the throat, then you're thinking of anterior plexus bleed. All right. So when you're thinking of
Okay.
anterior plexus bleed, I mean, any other nosebleed in young people, what are the things that you should be worried about? And also, this is unilateral, just one nostril. So what should be coming to your mind where you should rule? What should you be ruling out? Just the top of your head.
Drug misuse.
Foreign body?
Foreign body, all right, but it's kind of frequent, right? Foreign body, you can, she has no nose picking, what do you say, habits. Nothing is actually gone in.
Um,
Yes, go
could it,
ahead.
could it be like I don't know, like a malignant mass on one side of the nose?
Absolutely. It could be a tumor. Usually unilateral tumors actually do present like that, right? And there are also some vascular malformations that are very frequent in young adults. Polyp, yes, Dr. Farao is also saying that's benign, but it's still suspicious. It bleeds. Polyps also do bleed, right? Definitely. It could be some vascular malformation as well, right?
Mm-hmm.
And that's what you need to keep in mind. So your stuffiness question was very good, Is your when you do feel this way, is it usually that you feel stuffy? Do you feel stuffy on one side of your nose or both sides of your nose? Do you feel like there's a mass? That's a good question, because you're thinking, why is the bleed happening? Is it happening spontaneously? Because spontaneous bleeds are very common, let me assure you that. Spontaneous bleeds are very common. But the main thing that you have to do is you have to rule out any dangerous, symptoms associated with it. Do you understand?
Okay. Yes,
You
yes.
you have to make sure that it is something that is not too much of a health risk. All right.
Okay. Mm-hmm.
So definitely think along those lines. So you asked a lot of good questions about coagulopathy. How much is the quantity of the bleed? You want to see, the amount of the bleed. Usually and how long does it last, the bleed? Those are all very good questions, right? So you want to make sure that it's not a dangerous bleed. So when do you call a bleed dangerous?
Hello?
Yes, I was
Oh,
hoping
sorry.
somebody would answer that. How long should you wait for it to be called dangerous? It's something around 20 minutes, right? If it doesn't stop. And there was also another thing that she said, what do you do when this bleed comes on? That is a very good question. I really like that question. So I kind of improvised a little bit where I said that I pinch it and I go backwards. Is that correct? Should you be doing that?
No, you should actually be leaning forward.
Absolutely. So that's an issue you found in this. Very good. So that's why you have to. So when you're talking to these people, patients, you need to understand what is their current practice, and anything that they're doing is actually wrong or right. Right. So that you can bring it back in management. So whenever you're asking the questions, make sure to ask questions in such a way that you can have a management for it. So identifying that she is doing all this is a clue for you that, all right, I need to speak about this in management. All right. So good job on identifying that. So we'll quickly take a look at the results. Yeah, so since this is a case repeat mock, we actually have put this in our mock format. So this is usually the format that we follow for our personalized mock. So I'll just pull that up. All right, I'll just share my screen again, guys. I'm so sorry about the delay. Okay, so let's see. Confirm the full name and age. I actually on purpose did this for you. In fact, you started by asking, can I confirm your name and age? I said Lynn. But what is the full name? You should always, ask the full name, because those are your identifiers. There might be another patient named Lynn. So accidentally also you shouldn't be talking to another person's medical information. You shouldn't be disclosing any medical information to another person. You'd be liable for that. So definitely ask the full name and age, the identifiers that have been given to you. So do take heed of that. Ask about the concerns, clarify the nature of the event, ask the patient to describe the episodes in their own words. Yeah, I think I'll give you a partial for this. I wouldn't completely penalize you on that. Ask about the frequency and duration of every episode, assess the severity, clarify the site of the bleed, whether it's from one nostril or both. That was done very well. Inquire about the specific triggers. I think this you actually asked twice, so whenever you're asking the question, try to avoid repeating your questions because you get ticked in listening. All right. And you need to actually learn how to understand what they are trying to say from the first go itself, and then from the Socrates you need to rule out what all questions you need to ask and not. Right, because because in the first time you actually ask them to explain it in their own words, they may they may cover a lot of the Socrates. So you can't just keep asking the same question. So you'll get ticked on listening for that. So keep a mind of what all they have already answered. Maybe you could have asked this question by saying that, apart from the change in temperature that you've noticed that causes the bleed, is there anything else that triggers the nosebleed, or is there anything else that makes it better or worse, rather than just asking that question plainly? Because remember, you're having a conversation with this person. That means you're actively listening to what they have said, and you have in your conversation that should. Does that make sense, Dr. Natasha?
Yes.
Okay. Quantify the bleed. Ask about whether there is blood dripping down the throat. This is very important because you need to understand whether it's a posterior or anterior bleed, right? Even though posterior is mostly seen in elderly with a lot more comorbidities, you should rule that out, definitely, right? Screen for red flags, headache, dizziness, palpitation, shortness of breath, fever. Yes, absolutely. Dizziness and palpitation is something that you could have asked when you're thinking of anemia here. Ask about bleeding tendencies. I think I'll give you a full for this one. You did ask about this, any coagulopathy, right? Recent cuts. Yeah, any place where you have had an injury. How much do you bleed usually? Does it come, does it stop almost immediately, or does it prolong for a longer time? Review past medical history, surgical history, especially history of nasal trauma, surgeries, allergies, and known blood disorders. Yeah. Explore family history of bleeding disorders, and yes, you did do this. Do you have any family history? You asked this. And then examination. So your data gathering was pretty good, but I think you can still pick the questions you need to ask, Because if you notice, you only got to management when there was just 1 minute left. And do you understand how many questions you were asking for data gathering? I think you were repeating a lot of your questions. And another good question that you asked is about the cocaine use. That's very good questions. The nasal insufflation is one of the signs that you've seen in cocaine users. But do signpost when you're asking such an uncomfortable question, right? You can't just jump to the fact that, are you doing cocaine? Is that why you're having a nosebleed? That's a very uncomfortable conversation you're going to have, right? So do try to avoid doing that. But apart from cocaine, alcohol smoking, what do you guys think? Does that aggravate this nosebleeds?
Wouldn't those slow your, wouldn't they increase your bleeding time? Actually.
So usually when you're thinking about bleeding time, you have to think about coagulopathy. And the other thing that can increase your bleeding time is any liver disorders. All right.
Okay.
When you're thinking along those lines, maybe. But what do you think otherwise? Alcohol and smoking, will that make it more problem? Your bleeding, nasal bleeding? Alcohol, not so much, unless you have too much to cause any liver damage. But smoking, definitely, because it causes direct trauma to your nostrils and your throat, right? It causes local injury. Right, there is so much irritation by the particulates that is coming from the smoke, so that will aggravate it. So definitely smoking you need to think of. So about that, that's a good question. So definitely if you identify, so in my information it was not given, I just wanted to add in that. But definitely when you're thinking along those lines, you're thinking of any risk factors that can aggravate this problem. Right. So what you're doing in data gathering is you have in the back of your mind, all right, you have a presenting symptom of epistaxis, nasal bleed. Now you have to understand if it's anterior, posterior, you have to quantify it, you have to understand how long it lasts and what she does, right? Perfect. Once you've gotten that, rule out the risk factors, the most dangerous risk factors. That could be, any polyp, any, do you have, other than the blood, do you have any other discharge coming? Do you feel stuffy on that side of the nostril, right? Identify if it's unilateral or bilateral. And any bleeding disorders, any family history, any other underlying health conditions like hypertension, right? Or any atherosclerosis that she might be having. After you understand that, you have kind of got the fact that this is what we say nasal bleed, I mean epistaxis, right? A benign one. So think of all the habits that can be a risk factor. So you very beautifully asked about the nasal picking. That's good. Now you have to think about anything that might aggravate it. So you understood that, the cold is something that is aggravating it, and that is the desiccating effect, that is the drying effect of the cold. So you have to also think about other risk factors like cocaine and smoking that you did, just to understand what is her overall habit when it comes to this disease, Understand a little bit about, a very good question to ask is how this is affecting your daily life. So then she'll actually tell you, like in her own words, like, yeah, this is very troublesome, and she'll actually tell you her concerns, right? And then definitely ice. But when you're doing ice, definitely the entire thing, ideas, expectations, concerns, and expectations. Expectations are a very good question to ask. That way you will understand what your management should be focused on. Right? Everybody asks still concerns, but nobody goes on to expectations. Like, what are you expecting from today's consultation? What can I do for you today? Right, so that's a very good question to ask, definitely. Yes, so explain epistaxis. Yes, epistaxis is due to the frail nasal blood vessels aggravated by dry air or trauma. You ruled out trauma as well, that's very good. Ensure that the patient, reassure the patient that it's common and usually not serious unless accompanied by other warning signs. So you can talk about the other warning signs like easy bruising, excessive bleeding time, right? Any other sites of bleeding, right? Demonstrate the first aid, pinch the soft part of the nose, lean forward, hold for 5 to 10 minutes, and use cold compression. Why would you use cold compression? Why is cold compression so important?
Because it would constrict the vessels and reduce the bleeding.
Absolutely. Yes, absolutely. So yes, and that also you identified, like what is her practice? She usually pinches her nose and leans backward, and that is a risk of aspiration, right? And you don't want that. So you have to rectify that, right? Advice against nose picking and blowing the nose forcefully. So even though she doesn't have these risk factors, you can say that these are the things that do aggravate it. So please do keep a mind out for that, right? Recommend nasal spray to keep nasal lining moist. So this is very important. So this is what is actually causing the bleed, right? So you can actually give her nasal sprays. You can also give her some petroleum jelly that she can apply on her nostrils, to prevent it from drying out. Yeah, advise use of humidifiers at home during winters and in a dry environment. Mention nasal cautery with silver nitrate as a next step if conservative measures fail. Yeah. And then provide safety netting, leaflets, and follow up. These are very important. This is something that we tell everybody in all this. See, you could have done so many things with management, but by the time you came to management, it was only 1 minute left. Right. So do you understand? You can cut down a lot on your data gathering because you didn't manage to get much marks in management because of this. Right? Unfortunately. And there are so many things to cover. Don't worry, we'll try this again. Yeah.
Okay.
All right. So good luck, doctor. I'll just quickly share my screen again.
I just have a couple of points to add. So one thing I noticed in your data gathering was you asked, so you started with a closed question. So when you, after the presenting complaint, always start with an open question first. You ask, tell me more. You directly say, tell me more. They'll tell you a lot of things. That will cover a lot of your close. You started directly by saying, how long have you been having this? All right. So try to avoid that. Because that will take you into a path where you can't really go back and ask an open question again. So that is one thing. And another is you need to have a structure for your data gathering. It's kind of haphazard. You're asking questions, so you asked about recreational drugs first, and then after a few more questions, you went back to smoking and alcohol. So always make sure you have a structure. And your data gathering is way too long. It's 7 minutes. That's way too long. Make sure that it's only 4 minutes. And how you do this is for a station like this, which is symptomatic differentials, where you have to mainly focus on differential diagnosis. And these are the stations that have the best structure because there's nothing much you don't need to focus on. All you need to do is ask your questions, pinpoint questions. So you start with presenting complaint, go to ask about presenting complaint like elaboration, which is Socrates or Odipara. And immediately after that, you do your differentials. So differentials, you don't need to ask everything. Think about 3 C's, that is critical, cancer, and common. So that is first ask what is the most critical thing that could be causing this. So here it could be bleeding disorders, and then ask about cancer. So cancer, all you need to do is rule out weight loss and loss of appetite. That will remove that. All right. And after that is most common, which is just general epistaxis, right? So these 3 things, and once these three things are done, you rule out red flags, and then do your PMAF. Those are the past medical history, allergies, family, in smoking, alcohol, and then psychosocial histories, like how is it affecting your life, and that is very important. And then after that, you do your eyes, and then you move on to your management. Even if you don't get your diagnosis till this point, it's all right. Don't keep dwelling on data gathering anymore. All right. And definitely move on to management as soon as possible. Like 4 minutes is your cutoff for your data gathering. Try to practice that. And if you don't get your diagnosis, you still can manage your you still can try to say whatever differentials you're thinking of. You can say you'll talk to your senior, all these you can do in your management, you can still get marks. Because if you just continue doing more data gathering, you'll lose everything in your management. See, you got 0 in this in management. So yeah, why don't you try it again? Let's see.
Yeah, but that's all right, doctor. We're all learning over here. So yeah, let's go for another round. What do you say?
All right.
Okay, one moment.
Begin. Enter the room.
Good day. My name is Dr. Natasha. Can I know your full name and age, please?
I'm Lynn Taylor, and I'm 25.
All right. Nice to meet you, Lynn. Is that okay if I call you that?
Yeah, Lynn's fine.
All right. So I see you've come in with recurrent nosebleeds. Would you like to tell me more about that?
What do I say, doctor? Now it's getting a little worrisome. I mean, it's happening a little too often, especially this month.
Okay. I'm sorry to hear about that. Do you bleed from both nostrils?
I only noticed it in one, actually.
Okay. Is there any nasal congestion in that particular nostril?
I mean, my nose gets stuffy when the bleeding happens, but otherwise, no, not really.
Okay. And how much bleeding is it at each time? And how
I
long
mean,
does it last?
it's not much, I would say. It's just that, whenever I put my handkerchief, it's just a few streaks of blood. But yeah, it just goes on for like 5 to 10 minutes. But it's happening so frequently, especially during this winter days. It's kind of really, bothering me.
It's definitely understandable how worried you are. So, do you notice any blood dripping down your throat when you bleed?
No, not that I've noticed, doctor.
All right. Have you noticed any frequency in bleeding in other parts of your body?
No, not really.
All right. And is there anything that you do to stop the bleeding?
Well, I pinch my nose and I, tilt my head back.
Okay. And did you experience any trauma to your nose before the bleeding started?
No, no, surprisingly, no, I didn't actually.
Okay. Have you noticed any dizziness, any frequent headaches or weakness since this bleeding started?
No, doctor, it's just the bleed. It's just the bleeding, that's all. I don't feel anything else. I just get a little worried whenever I bleed.
All right. So it's understandable how worried you could be. Have you have you noticed any fever or any relation to having a cough when this bleeding happens?
Um, no, not really. It just happens on its own.
All right. So just like to move on to ask a few things about your medical history. Do you have any known long-term illnesses, especially related to bleeding or any liver disease?
No, doctor.
Are you on any medication?
No, doctor.
Okay. And that's including blood thinners, right?
Yeah, no blood thinners.
Okay. Do you have any personal, any family history of any cancers, of any bleeding disorders?
No, not really.
All right. And just wanted to find out a few things that are more personal to you. Do you smoke or drink or take any recreational drugs?
I do smoke and drink from time to time. Just with friends really, but nothing else.
Okay, that's fine. And just wanted to find out, do you have any thoughts on what might be causing this bleeding?
I have no idea. I was hoping if you could give me some clue.
I'll definitely do my best to figure it out. And do you have any particular concerns or anything that you're hoping that I would can do for you at the end of this consultation?
Yeah, I mean, you've also been asking me a lot of this bleeding disorder questions. I've read somewhere that, sometimes it's caused because of that. Just want to make sure it's not that.
All right. Definitely try to address all of that. So I'd like to move on to do an examination. I'll check your vital signs and do an examination that's more targeted to your nose. Is that okay?
Sure, doctor.
All right. So putting together what you've told me as well as the findings that we had on examination, I suspect that you have something called epistaxis. This is just bleeding from the nose. It's quite common, and especially in the environment that you described of cold weather. The blood vessels of the nose, they are quite close to the skin. So the harsh cold air can irritate these blood vessels and cause bleeding.
Oh, okay.
All right. So what I'd like to do for you, we'll do some investigations just to check if there's nothing more sinister going on. It will definitely include a clotting profile, which will help us to see any risk of any bleeding disorders. Is that okay?
Yeah, that sounds great. Sure.
All right. And also, if you notice this bleeding at home, what I'd like you to do, yes, you can pinch your nose, but rather than leaning backwards, I'd like for you to lean forward and you pinch and hold your nose for 5 to 10 minutes whilst you breathe through your mouth. Does that make sense?
2 minutes remaining.
Yeah. All right. Yeah, sure. I'll do that from now.
Okay. And the other thing you can do is apply an ice pack to that area. And if and something else that you can do at home, you can avoid picking your nose. I'm not sure if you don't do that. As well as blowing your nose aggressively. And like we identified, the cold air is the biggest problem. So you can use a humidifier at home or use a saline nasal spray to keep the lining of your nose moist.
All right, I'll do. But you mentioned I should put some ice pack. Doesn't that make it more cold? Won't it worsen my condition?
No, actually. So just avoid applying it directly to the skin, but applying an ice pack will help to reduce the amount of bleeding.
All right, sure, I'll do that.
Okay, so something else that we can do if all these measures don't work, we can try something called nasal cautery, which is sort of like a procedure where we try to burn the blood vessels of the nose so that we don't experience any bleeding.
All right, sure, doctor. Yeah.
Okay. So I'd like you to come back if you notice the bleeding doesn't stop with the things that we've talked about, or you start experiencing dizziness, headaches, and weakness, and you notice that you're swallowing large amounts of blood.
All right, sure, I'll do that, doctor.
All right. So I'll see you in a month's time to see how your condition has improved, and I'll also give you a leaflet about Epistaxis. Is that okay? Anything else that I can
On
do?
to the next station.
Amazing, doctor.
I had a timer right next to me.
Absolutely, that really helps, right?
Yes, but I felt like I left out so much more now in data gathering, just trying to make sure that I fit everything within the 8 minutes.
Yeah, because that's the thing, right? You already in the last attempt. Can you just tell me how long into the conversation did you realize this was epistaxis? Like, when were you sure that it was epistaxis?
Okay, now it's difficult to tell considering we've done this case before, but I think when I was asking some of the more, I tried to stick to the 3 C's, like he mentioned, when there was no weight loss and there was no nasal discharge, there was no swelling of the blood. And she said no to all the other, to using blood thinners or to smoking or to using any recreational drugs.
Yeah. See, that's the thing, right? As soon as you understand what the diagnosis is, you just have to quickly rule out the critical ones and move on to and understand how it's affecting their life, any risk factors in their life, and just move on to management. so that you can ask, you can, manage those risk factors as well as any way that it's affecting their life, because that's also important in management, because you're not just treating the disease, you're treating the person. So you need to understand the holistic picture. So that was great. I think that was really great. All right, so let's take a look at the sheet. I'll just quickly pull that up. Yeah, this time even I felt that there was a structure too. That was actually good. Even when you were asking about the alcohol and smoking history, like that was a very good way to say, do you have any other recreational drugs, rather than accusing them, saying that do you take cocaine?
I think the cocaine thing just sort of came to mind at the time. And because I know it's such a sensitive question, I really struggle to vet properly.
Yeah, definitely. Yeah. So let's say you definitely confirm the full name this time. Yeah. You can either start the conversation by saying, am I speaking to Lynn Taylor? That way you are delivering the full name and you're not expecting them to just give you half the name. Right. So whatever you can control, try to take control of that. Right. So that you don't lose out on the marks. So am I speaking to Lynn Taylor? Can you please confirm your age for me? And that way you're even reducing one question, saving time, right? Acknowledge the patient's concern about recurrent nosebleeds, clarify the nature of the presenting complaint, ask the patient to describe the episode in their own words, ask about the frequency, duration of each episode to assess the severity, clarify the site of bleeding, whether if it's from one nose or both, inquire about any specific triggers. Yeah, this is some question you could have actually asked, like, you could have understood like what makes it worse, what makes it better. But you did close it a little bit and ask, do you have, do you have any sneezing or cough during when you're having these bleeds? But a good question would be like, anything apart from this, change in weather that you mentioned, do you have anything else that causes these bleeds, or, even help stop these bleeds or reduce these bleeds, right? Quantify the blood and ask whether there is any blood dripping down the throat. Screen for red flags. Ask about bleeding tendencies. Review past medical histories or surgeries. Explore family history. Do general physical examination, vitals. Absolutely, that's great. Another good question to ask, and this I'm just saying, because these are the important questions that we put down, making sure that, by asking these many questions, you're good to go. I mean, by this itself, you'll understand what the diagnosis is. But since this is a lady and she's having bleed, you may want to ask about the menstrual history. Does that make sense? Especially since it's related to bleed, just like, and you've already asked about bleeding disorders, but that's also fine. You can also find a little bit about the menstrual history, but not that important. But yeah, you can just keep that in mind if you do have some time. Awesome. Now, explain. I really like the way you explained the Epistaxis. That was very well done. Reassure the patient that it's common and not usually serious, unless accompanied by certain warning signs. Demonstrate the first aid. You did that very well. And you actually had a conversation. This is exactly what I'm talking about. You identified what they are doing and say, I like the fact that you're pinching your nose, but do make sure to lean your head forwards rather than backwards. Yeah, that was actually good. That's where you're actually building on what they are already doing and rectifying something that they are not doing right. So that's very well done, I have to say. And then demonstrate first aid. Advice against nose picking and blowing the nose forcefully. That's good. Yeah, because those are the things that can aggravate the bleeding. Yeah. Recommend nasal spray to keep the lining moist. Suggest petroleum jelly applicants to make the nostrils moist. Yeah. Advise humidifier. I think you did this, right?
Yes.
Humidifier said. This one, I don't think the petroleum jelly you did.
No, that one I didn't mention at all.
Yeah, that you can actually save, that's also something to use. And then you mentioned cautery as well, safety netting, leaflets, follow-up. Yeah. So usually the review is around 1 to 2 weeks, especially if you're doing an anterior nasal packing, because you have to change them. Right. So the changing of the anterior nasal packing just happens like in 1 or 2 days, otherwise it can get infected if you're doing the anterior packing. But why is follow-up important? Because you're trying to see whatever the measures you have given, is it working, right? If it's not working, you can, change your, management a little to suit them better. Do you understand? So you've
Yes.
given them a way to understand to help with the nosebleed, and you are just trying to understand if it's working, because according to their lifestyle, it might not actually work. So you can actually give them something else that can help with the bleeding, where you can talk about the nasal packing and how to do a nasal packing, right? Those are something to add on. All right, that was great. Thank you so much, Dr. Natasha. So we will be posting a very detailed feedback on your performance on both 1 and 2 performance, so that you can actually see it. Yeah, we'll actually give you the video recording as well, so you can actually see for yourself, like the change, or how to do a consultation, how you actually improved in the first and second. So this is something that we actually want to get into practice, because every time you do a case, you're doing it, kind of little blindly, thinking what should be important from your perspective of things. And when you actually understand what are the important things, how to structure your conversations and your consultations, and practice it again, there, you go in with the structure, and that's exactly what you guys need to prepare for in the exam. You should go in with a structure, rather than being, like befuddled and thinking of questions to ask. Whenever you're asking a question, you need to have a reason behind why you're asking them. That's very important, because if it's a positive or a negative finding, you can actually bring it back to management. Ultimately, you're trying to manage the patient, so you need to ask relevant questions that might be important in management.
Please like and subscribe to Turing Med School. Good luck with your preparation.